Managers, this meeting is partially in person and via video conference as allowed under the Open Meetings Act. So we will need to reiterate our ground rules and technology issues. Our staff will be monitoring the feed for the meeting to make sure it remains visible and audible to the public online and here in the Central Health Boardroom. In the event the online portion of the meeting suffers any loss of video or audio, we will take a short recess and attempt to address those issues. As we have done in our last several meetings, we will entertain a motion to limit debate for board meeting, and staff will be asked to keep presentations within preset time limits. Also, members, please ask for permission from the chair before speaking to ensure that microphones can be activated. For our virtual public participants, you will be muted and your video kept off until it is time for you to provide public comment. This will ensure the Board of Managers video feed remains visible at all times as required by state law. When it is time to provide public comment, your microphone will be unmuted and you will be invited to turn on your video if you wish. Public communication. Our first item of business is public communication. We will receive public communication for both the Executive Committee and the Board of Managers meeting before we proceed to the committee agenda. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 3:30 p.m. Yesenia, has anyone registered to make comments for either the committee meeting or the Board of Managers meeting?
Yes, Mr. Chairman, we have one person who wishes to speak.
Great, please proceed.
When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. We received one submission for public comment, and I will now call on Manager Cynthia Valadez for public communication.
Thank you very much. My comments are going to be regarding the University of Texas Dell Medical School and questions that have been left historically unanswered by Dean Johnson during his tenure. And I was hoping that we would have an opportunity to question the representatives, but they are not here today. So I'll resubmit my questions and ask that they be put on the message board prior to our September meeting or as soon as possible. And I also appreciate that Dr. Bell, that you and Dr. George McConis have been communicating regarding the medical school and its performance, rather its accountability for the $35 million that they received from us and from the taxpayers, Central Health and the taxpayers. Almost a year ago, I began, throughout my tenure, since I was first appointed to this board in 2015, I have asked questions of the University of Texas Dell Medical School. And after they were up and running, I continued to ask those questions and never really had any response. I don't know whether or not that may have been due to any movement on behalf of Central Health or board chairs to keep me from asking my questions in full or to have them responded to in full. But either way, we will hopefully get to the bottom of this, and we will eventually have answers for not only my questions, but any of the questions that board members may have. I do believe that it is my fiduciary responsibility, and which I take very seriously, considering the fact that we are using taxpayer dollars, $35 million every year to an entity that we assumed, the public assumed, would be providing services and medical costs, medical care to our targeted population. The targeted population, which is less than 200% FPL, the uninsured and the working poor. I have not yet seen any accounting for how those dollars have been spent. I don't believe we have ever in writing received any accounting for how those dollars have been spent. And so I am again asking in writing that they be accounted for, because it's not only me that wants to know. It should be every person that is not receiving services and whom I believe the University of Texas Dillon Medical School should be providing services to. If they are not, then why are we providing them with $35 million a year? It's that simple. It's very basic. So since they're not going to provide or be here today to make their presentation, and they will be here in September, I will speak again in September. And by then, hopefully we would have resolved, at least between my chair and my CEO, Mike
30
Gilson.
seconds remaining.
Thank you, hon. We would have resolved the issue of how we're going to get some very basic questions answered, not only for ourselves as Central Health Board of Managers, but for the public. And I appreciate your time. Thank you.
Thank you, Manager Valadez. I appreciate the comments. Do want to say that they will be back next month in July, not September.
Oh, okay.
And unfortunately, there was an illness among the presenter, and therefore they were not able to attend today.
I appreciate that, Dr. Bell. And I'll give you a copy of what was developed by me last year and not responded to. And I may have some more or additional questions to provide prior to the next meeting in July. Thank you very much.
Thank you. Yersinia, anyone else?
We had one other person that signed up, but they would like to postpone theirs as well until the meeting when Dell Medical School will be here.
Okay. Well, thank you very much.
Thank you.
And we will now proceed to the, I'm sorry, Manager Jones.
I just want to make sure I understand. So regular agenda item 1 for the board meeting is not occurring tonight. Is that correct?
It will not occur tonight, and I will make that announcement when we go into the meeting.
Okay, we're just now finding this out though.
Just now finding this out.
Okay, all right then. Thank you.
Mm-hmm. Okay, we will now proceed to the executive committee agenda. First item is to approve the minutes of the Central Health Executive Committee March 30th and May 25th, 2022 meetings. Manager Valadez.
Yes, I move that the committee approve the minutes of the Central Health Board of Managers Executive Committee meetings on March 30th and May 25th of 2022. Thank you.
I have a motion by Manager Valadez. I have a second by Manager Zuniga. Any further discussion? All in favor? Any opposed? Any abstaining? Motion carries. Agenda item number 2, receive and discuss a presentation regarding Integral Care's strategic alignment with Central Health Equity-Focused Healthcare Service Delivery Strategic Plan, parentheses, Healthcare Equity Plan. I'd like to welcome Dr. David Evans and Mr. Hal Katz will be our guests. And I think that table up there is where we're placing the presenters.
Good evening, board members. Thank you for having us this evening. Excited to have this conversation.
Thank you. Hal and David, first of all, thank you for your time and for being here today. We really appreciate it. What we've been doing, and I think I've sort of mentioned this to you in the past, is bringing our partners here and just having a dialogue between our partners and the board with regard to our strategic plan, your strategic plan. Are we aligned in areas? Are there areas where we may be causing a barrier, all right, to what you need to get done? Are there areas that we could have more collaboration? So it's really an open dialogue. You know, I know you guys come once a year to present to us all the services that you do, which are great, by the way, and we appreciate all of that, and your budget. But this is sort of more of a strategic conversation. And so I'll open it up for you guys, and you can sort of, you know, give us an idea of any of those items that I mentioned. And then I may have a comment or two, and then I'm gonna go around and ask the board members to ask questions and maybe comment. Okay?
That sounds great. Of course, we're lucky to have Dr. Zamora on our board, and he does a great job of sharing his insights as a board member from Central Health. So we're coordinated, at least in your thinking and your planning, to the extent it overlaps with what we're trying to do. And to Dr. Zamora, thank you for being on our board.
I'm blessed to be on your board. You all are doing incredible jobs. You know, at the last board meeting, Dr. Chair, my statement to Integral Care was they especially David and Hal, they stretch that dime, that penny, as much as they can. Those $8 million that we give them for our care of our patients is remarkable work. I told them I would be in favor even giving them more, because they do such incredible work for our homeless, for our patients who need it the most. Thank you for allowing me to be part of your board. Thank you, Dr. Chair.
Thank you, Dr. Zamora.
We do have a check for you to sign here in a minute.
Okay.
Be there in a minute. And of course, so I'm one of your appointees to the Integral Care Board, along with, of course, Dr. Zamora and Trish Young, who also does a great job with all the experience that she brings. And she regrets not being here this evening. As far as our equity plan, I mean, this has been not only a major priority for Integral Care and the board, it's been a personal priority for me as chair of Integral Care. Roughly 2 years ago, we appointed a special committee of the board to focus on racial equity and issues, opportunities, and a recommended plan for us to focus on throughout the organization, both internally and externally, and make sure that we, you know, are always, the term is today, you know, using a racial equity lens to see everything, our policies and procedures, our data, our outreach efforts to the community, our recruiting, our retention strategies. And there's been a lot of real work, hard questions, you know, hard conversations. That committee is led by Emmett Smith, one of our board members, and he's doing a great job, and there's several of us on that committee. So that's high level. That's being rolled out through also the hiring of our first chief equity officer. I guess he started, what, 2 months ago now? 2 months ago, and we're excited to have him on board so he can own and be responsible for these issues, these initiatives throughout the organization, and report to the board and help us oversee the implementation of this plan, which is embedded in our strategic plan, as well as our business plan. So that's super high level. David, I don't know if you want to go into in a little more detail, or do we want to open it up to questions that you guys might have around those initial comments?
David, did you want to add anything before I?
It's great to be in here this evening with you. I've been in this room over 100 times probably, but not in the last 2 years. And so
Oh, yeah.
It's wonderful to be here live and interacting on this important topic. Mike Gieselin reaches out at least monthly. He comes over, we discuss your strategic planning, and we talk about alignment of the organization. So in terms of staff leadership, we have had that over time. Hal is much too modest, not only with the 3 board appointments that he outlined, in terms of Dr. Zamora chairing planning and operations and Trish Young Brown chairing finance. They really comprise the officers and right at the leadership at the top of our organization. And so I appreciate that. The other thing I think is obvious to everyone, but with the city and the county, each appointing 3 of our board members and you appointing 3, it's that also city and county alignment that really, I think, joins us at the hip. You know, we do have that common public responsibility, but we also have that responsibility back to the citizens of Travis County through local government. And I think that's important. I think that that provides an opportunity of some common purpose, common cause. And I think that when we've had a chance to be on the advisory committee, looking at your strategic plan development, sending over copies of our strategic plan, there has been an opportunity to, at least in the larger picture, for alignment. So again, I think that in the dialogue is probably where we can pick up the best ideas. We want to be responsive to you. I would echo this idea, and I would close with this, Hal, is that this idea of equity lens, you know, so many of the things are easy to say, but I think that what we've really tried to respond to our board on has been organizational accountability. I'll give you some examples. The 15 class standards that outline from the federal government reporting areas that we are trying to work on demonstrating change, not just lip service to these areas and ideas. The GAR, you know, government accountability on race and equity, to utilize that toolkit and to be able to implement change, and then have on the executive management team a chief equity officer that's able to look in the same way that our chief financial officer is looking at the finances. He's paying attention to a list of things now within our plan. And I'll close with saying that that plan includes things like procurement. Does our staff reflect the Travis County general population? Are we utilizing tools that are getting accurate diagnostic assessments? So I won't go through the list, but I would like to think that we're making accountable change, and I would maybe end on that point.
Thank you very much, David, and thank you, Hal. I appreciate that. I guess one question that comes to mind, and I know that Community Care mentioned this as well as other FQHCs that I have a relationship with, and that is hiring and finding individuals in this current environment. I know that in our strategic plan, we looked at our provider gap. And I know just from my experience that healthcare providers have always been sort of rare in our area. The state continues to increase the enrollment of medical schools and other professional schools. But as our population growth increases, we tend to sort of stay behind. The other thing that always becomes a problem is that professionals don't stay in the places where they go to medical school. Many of the professionals stay where they do their residencies and their fellowships, but just having a medical school isn't necessarily going to guarantee that you're going to have a full spectrum of both primary care and specialist. So knowing that behavioral health and that substance abuse has their own sort of cadre of professionals, my question to you is, are you having issues trying to find those providers and those professionals? And secondly, is there a way that we at Central Health might be able to sort of assist as we look for professionals that may not be aligned with us or right for us, but could be right for you, can we assist you in trying to help fill that gap for you?
I suspect so, to answer the question. We are looking at recruitment efforts very closely, everything from who we're reaching out to for candidates, qualifications. We're looking closely at qualifications, what truly are necessary for the jobs. Which credentials, what level of education, what level of experience is truly essential. And David, I don't know if you want to talk about the coordination opportunity with Central Health, besides saying, yes, we would love to coordinate with you guys. I think it is a little bit different for our non-physician clinicians. You want to speak more to that?
Absolutely, would like to explore the ideas, and that we've averaged over the last 5 years between 18 and 20% turnover. That's across our whole organization. When we started into the second year of the pandemic, during last summer, we had about a 50% increase in that and had a 30% turnover within our organization. So we have taken a couple of steps internally. For the first time this spring, we have given a cost of living increase. We moved our minimum hire from $15 to $20 an hour. Now, this is entry for all staff, whether that be front desk to call center. And we've also then have started to partner some recruitment efforts. We're working with the medical school. We have now 5 or 6 physicians, and this is true of community care also, in which they're the employer of record, but we're able to pay for those employees at the rate that we pay for our medical staff. We're also working on things like an Addiction Institute for residency training program, and we think that there's going to be some important ability to hire through that means. And then we've really expanded our outreach with recruitment, and part of our Chief Equity Officer's work and job has been to build those relationships across the state. And I think that's the type of thing that maybe we should be exploring right here in our own backyard with Central Health.
Excellent.
We're also working on advancement opportunities. So, to help improve the retention rate, giving individuals the opportunities to obtain a higher level of credential and grow within the organization.
Great. Fantastic. Thank you very much. I'm going to go to my right here. So Julie? Manager Zuniga. Yeah, you have to press the red and it'll turn green. There you go.
Thanks for coming today. I was wondering if you could tell us about specific policies you have for the transgender community to address the equity for that community.
Wow. So what we've done is we've had internal staff committees. We've had a committee on staff satisfaction, and we've had a clinical committee. I won't go through them all. A safety committee, and recently we have established, in listening to our employees, a recruitment and retention committee. Second of all, we wanted to have representation from all of our employees, and we now have established a 38-member employee council. And then last month, for the first time, we've entered into a consultation policy with those employees who have joined the Communication Workers of America in terms of a union.
He was hoping by the 4th one he would remember the transgender policy, but I think we're gonna have to come back to you on that, unless you're gonna hit that one.
You said you were gonna slip me those notes.
I was even thinking just simply like,
Yeah.
do you have pronouns? Do you have?
I'm sorry, I didn't.
Even as simple as that. I know it's very complicated. Just wanted to bring it up.
We have been
somehow.
doing work in that area. I don't remember exactly the policies around it, but
Yeah.
maybe you can speak to some of the steps.
So-
It's just something. It's something to think about during this.
No,
Right,
it
yeah.
is important. So in terms of pronouns, we have just an encouragement for folks to identify in what they are comfortable with and certainly understand the issue. We have had some of our staff say that they don't want that required, that may cause there to be individuals that are not comfortable using those pronouns. And we want to be sensitive to the employee recommendations. And I apologize for not fully listening to your question.
No, it's
I heard the
fine.
retention part, but yeah.
And specifically about nurses, we're going to lose, I'm the nurse, we're going to lose a lot of nurses. Do you have anything specifically for nurses for retention? Because it's not, a pay is not going to be enough. You probably can't pay as much as a traveler nurse is going to be able to make. It has to be more. Yep.
Yeah. I can't give you any specific examples.
That's okay, just as long as you guys are thinking about us.
We are, well,
Yeah.
yes, all of, so we are going through a compensation study. I think that's
Finished, yep.
finished with I guess, have we gotten the full report and
We've gotten the full
implemented?
report.
Okay, yep. So we did look at all staff compensation and benefits and made changes across the board. It's hard. I mean, it's so hard. It's so expensive to live in Austin right now.
And we can't make any more nurses. We're going to have a problem. And so being a good workplace is just as important as having good pay.
Agreed. I was having a conversation with someone about that. If we take care of our people, culturally have a workplace where people feel safe and heard and respected and appreciated, often that can make up for, not the highest wages. We need to make sure, of course, we have a livable wage. And we're working hard to do that. We're going to be coming back to the more money. That's one thing.
And also giving a voice or giving, being at the executive level. So thinking about nurses that way too.
Yes, yeah, and
decision-making process.
Yeah, and you heard David mention our new employee advisory committee that we're standing up and working with and supporting their deciding how to be governed. You also heard that we are now working with a union that represents a good portion of our employees. We're hoping those efforts will help bring about further support to all of our employees.
Those are my questions.
Thank you, Manager Zuniga. Manager Velez.
Okay, thank you. And I appreciate Manager Zuniga raising the question of training because if we're not doing everything possible to make them feel welcome, just like some that are not feeling welcome, well, if we don't get there as quickly as possible, then we are being discriminatory in our policies. And so you need to really look at developing those policies and implementing them. Some may feel uncomfortable, but that all happens with change. Okay, so change is uncomfortable. You don't want to be litigated against. So just note of caution. My concern is whether or not your agency from the top to the bottom represents the demographic that you serve. Real simple questions. Does your board reflect whom you serve, the percentages of the demographic population, and your staff at the bottom? Are they demographically representative of the people that they serve? I asked David a question coming in about the increase in there's so many more that appear to have mental health problems that have not been verbalized prior to now. There also appears to be a great increase in poverty. And in speaking with the new chief of the EMS, their big concern is that when they have to deal with crisis, especially mental and behavioral health crises, when they're called to the scene by APD or the sheriff's department or the constables, and they try to take them, these people over to integral care or some of the facilities, that there are never enough beds. And so because there are never enough beds, and we know that we're dealing with an increase in the numbers of people that are having or exhibiting these crises, how will that be addressed? When will we have enough beds? Is it money that you need? Then you need to ask for more money. And whether or not you're getting the resources from the county and the city equal to us or more than us, we'd like to know. Ultimately, what I personally would recommend, and I told this to him, is when they have discussions with the police department, with the fire department, with EMTs, with integral care, with central health, and with others, that they look to jointly addressing the needs of that population, which is growing by leaps and bounds. And so if there's a way for you all to arrange those meetings or to participate in those meetings or create those meetings, I think it would be very helpful to show that at least we have an interest in addressing the needs, maybe beyond the immediate psychological, mental, and physical needs of the person. So we can finally get to the roots causes and look to see how we can work with the school districts and other governmental entities to work with their populations and reach out, do community outreach, community education, et cetera, things that are happening in other areas, but not necessarily at the same pace that they should be happening in our professional world. So that's my suggestion to y'all. And if you don't know the EMT chief, Robert Luckfitz, who's here from Jersey City, you all need to really get to know him. He has a lot of great ideas and talked about how growing their own professionals by working with the school system there and developing an academy at the high school level was proved to be very successful. So I'm a big fan of grow your own nurses, grow your own teachers, grow your own doctors. That's what we wanted to do with the UT Medical School. And we didn't want them to send the residents off and running to other areas. We wanted them to remain here. So these are the same kinds of things that we would hope that y'all would engage in. And thank you very much.
Any comments?
Got a couple. This isn't enough. It's just your first comment on trans youth. This month, we're holding our community forum without youth as part of the community information that we're providing. We did put out an organizational statement maybe 6 weeks ago or so in support that our mission is healthy, or our vision is healthy living for everyone. And that's not just for some, but we want to be sure that our access and our quality of care is the same for everyone that would seek our services.
Thank you, David. Appreciate it.
And if you could get back with me on those demographic numbers.
Yeah, I will do that.
I appreciate that.
Thank you. Manager Motwani.
The bottom button.
Thanks. I'm not really good at technology things.
Yeah, right.
Certainly glad to have y'all here and appreciate y'all sharing the alignment of your strategic trajectory and of course ours. Any nuggets of wisdom that have come? Are there any nuggets of wisdom that you think maybe that have come from the unionization effort and that process? I don't think everybody has the quote unquote privilege to participate in that process, especially a nascent union. And of course, the alignments of incentive and misalignments of incentive that could be there when it comes to a broad variety of perspectives for sustainability. I think traditionally, there are a lot of sort of operational things that by means of inertia really won't happen barring some strong outside forces. Sometimes things like raising that minimum wage from, or that entry level from 15 to 20 might be one of those things. Of course, market forces might force that as well. But have there been any sort of unexpectedly positive nuggets of wisdom or developments that you think may not have resulted in the absence the unionization effort.
It's still really, really soon, so
Mhm.
I don't think we have that yet. The nugget of wisdom that I have, more of a reminder that communication is best. Open lines of communication is best, and not make assumptions of what someone means or intends when looking at something you receive from them. Because often there's more to it than the one dimension you see and what they're requesting or what they're saying. I think for both sides, the follow-up in-person communications, in person, at least via video, were really helpful in clarifying what each party was trying to say to the other. That was being lost through just the email communication back and forth. I'm optimistic. I think good things can come from this. Between the work of the union and the work of our advisory committee, our employee advisory committee, hearing from all employees is what we want. And if those are the two platforms for them to share what's important to them, we're happy to engage them through both.
Do you feel like there's strong crossover between the union and the advisory committee and as much as representation is concerned?
We haven't looked at that closely. I think we just got the members, or at least confirmation on what % of our employees are members of the union. I haven't looked at that closely yet, so I don't think we know just yet. I don't know if you have more.
In order to be a qualified union representative, you have to have a threshold of 5% of the non-management employees join the union. We received from the Communication Workers of America that they've received that, but they have a process for third-party verification, and that hasn't happened yet.
So
And then I don't have a therefore because of this, but just in terms of the insight, to have employees come to a meeting, formal board meeting like this, and with public comment say, here's things that need to be improved in this organization, and then say, I love working here. Those messages side by side, I think, are really powerful. Didn't we hear that almost every time?
Yeah. I think you can get that from most marriages too. So that's
That's expected.
Well, I appreciate that. I think that is certainly the kind of nugget of wisdom I might be looking for. And, I also appreciate you all calling out just a union effort, of course, through the lens of staffing, sustainability, retention, and healthy workplace. It can't be ignored. But I appreciate you sharing. Thanks.
And just to kind of riff, it's going to be, a learning process for us. It's going to be bumpy. As I think Cynthia said earlier, change is hard for both sides. This is going to be change for us. We're going to get some things right. We're going to get some things wrong. They might get some things right and some things wrong. Our heart is in the right place. Hopefully they'll know that. We appreciate our staff. We couldn't do what we do without our staff. They're invaluable. We wish we had more resources. We would love more resources. If back to the money thing, we hope to maybe come back to you guys along this line and look at maybe opportunities for restructuring some of our funding that might create a little more flexibility around how we deliver service and how we allocate costs. So that's some of the other thinking that's going on internally.
That's excellent, Hal. I like the idea of, looking at how you can utilize funding in a more flexible and efficient way, because sometimes as governmental entities do, they make it very strict on how you spend the money and how you account for it. So sometimes by making tweaks in that, I think you can probably move activities as well as strategies forward more efficiently than you have if you're so structured. So, Manager Jones?
join my colleagues in thanking you all for coming out and giving us an update. I really appreciate it. I have just a couple of quick remarks and be interested in your comments. One is that, can you speak a little bit about how services are provided, mental health services in the larger counties of Texas, in terms of mental health services, commensurate with what we're doing here? Recognizing, of course, there's disproportionate population, but I'd be interested if you have any comments on that. The second question, somewhat related, but more demographic, more geographic, is, can you speak a little bit about, given the growth of Austin and Travis County, where are our current service delivery ports, and where do you envision over the next, let's say, 5 years? And I know you can't give me an exact number, but where we're headed, given the impact that gentrification and cost of living is having on central Austin, where do you see you're going in that?
So the second part first, most of our services are right up and down I-35. If you take our 42 facilities or entry points, they're not far east or west on that. I think that in terms of where we're getting requests currently, where we're working, with central health, discussions with community care, seeing that, I guess we're not using the term so much suburbanization, but, moving out from the urban core. So we're in discussions with Commissioner Trevelyan and Maynard schools, communities and schools. I think that we're trying to map where our call center is actually taking calls and to align the needs from where we're hearing from citizens and then access points. Then we're reevaluating a little bit because, like a lot of places, we move to a significant percentage of our services through telehealth and not necessarily having to meet in person. So as we're the dynamics for planning right now have to do where the requests are coming from, where we're mapping our data from the call centers, and how we're rebalancing access points with rebalancing with telehealth. So I can't, we have no current facilities under development apart from the next building we'll open and move our call center to I-35 between 290 and 183 in what's called the Founders Building, or the former ARC administration building.
And then the other question on Harris and
Well,
Bear.
just quickly, given what we're seeing in terms of the growth and development here, are you looking at what's going on out in those, in the Eastern Crescent for one, and in what I've been told now, we have the Western Crescent. Are we looking at, who's moving into Austin and who's being fleshed out? And as my colleague, Manager Valdez talked about, who our target populations are those who are being significantly and quickly. I'm not talking about 10, 15 years. Just in over the last 2 or 3 years, we've seen significant migration out. So I'm just wondering if you're all considering that process and if you're putting in place the structure and the planning to do that.
We're putting in place, we have on the data gathering, but we don't have any specific facility development plans as of yet, but I acknowledge the importance of looking at it more carefully. Then I meet monthly with the other 38 local mental health authorities. In that opportunity, I have a chance to meet with Harris and Bear and Dallas, larger centers across the state. My general belief is that each area has maybe an area of particular strength or a deeper area of development. As an example, Harris County has really spent a lot of time with their criminal justice system in working on what they call diversion activities, a diversion center. And I think many places visit them to see how they're ahead. An example of how they're ahead is before charges are made, law enforcement checks with the county attorney's office on misdemeanors. There's areas that we don't do here that we haven't caught up with them yet. Dallas is unique because they moved to a third party that serves as the authority separate from the direct service provision. So the Public Mental Health Center in Dallas subcontracts with an entity on North Texas Behavioral Health Authority. That was a remnant when the state tried to move to privatization and had private companies that oversaw the delivery of services in a multi-county, I think a 7-county area in North Texas. Bexar County, as an interlocal mental health authority, moved to being a leader in many ways with homeless services. Has been different developments there that folks from around the state have taken a look at, acreage that they've set aside, and they've congregated a lot of their services on a 20-acre plot of property, so they have a much more coordinated view. So I'm just going to try to pick out areas of strength within the urban centers. Our interest as a trade association is to learn from one another. One of the unique things that we have done here in Travis County is that we've formed interlocal agreements with the city and the county. They don't have to go out on competitive bid in order to do joint planning with us and to design and to develop some service areas. And that while the city of Austin is the largest funder of integral care of our 3 appointing agencies, other cities in the state like Fort Worth doesn't fund their local mental health authority. So I think we have a unique role here where right at 25% of all funds that we receive, all revenue, is from the city, county, and central health. That's not true across the state.
Thank you very much, David. Thank you, Manager Jones. Manager Musaitis? Don't forget to turn your. Yeah.
Well, thank you so much for your time and talking with us. I think all my colleagues hit on retention and employment. Now, what I've read, it just kind of concerning me, what I've seen is about the many who left your organization and and I know you have a lot of aspiration to do great work, but without the people, you're unable to meet the needs. And I know that you've mentioned that you've increased salaries to that part, but sometimes money is not always what keeps people. It's the culture of the organization. And I wanted to see what changes have you made to retain these great individuals who are making your organization great at a really much needed time addressing mental health. So that's really what I wanted to have a dialogue. Maybe we can discuss it further later on, but just thinking about how can you retain the people that you have and build a culture that is welcoming, embracing to all, and a healthy environment. Thank you.
We'd love to report back the more comprehensive approach that we plan on taking around culture building and retaining that culture. There have been many initiatives that have been implemented to support well-being, mental health, and other growth opportunities, but I don't think we've got a comprehensive plan, and that's one of the things we started right at the time the union was formed, or those efforts to start the union was formed. So we pivoted a little bit to focus on the issues that they were identifying as a priority, and those were, the dollars. And so we wanted to make sure that we showed them, action was louder than words, and so we focused on the dollars. But I completely agree with you. As I was saying earlier, I know personally there were a lot of jobs that I had that I was proud of the work that I was doing, and I loved the people I was working for, and I was not getting paid very much money, but the work I was doing was worth it. It was paying me in other ways. And I think there are many opportunities for us within integral care to make sure we're creating that environment, that support, and investing in our team, not just through comp and benefit, but comp and benefits. But I never want to, I never want people to hear us say that, we don't think a livable wage is, just as important. It's a livable wage plus the culture that we've got to create.
Just put a footnote that we also survey our staff every year and ask them on satisfaction. And this last month or two, I think maybe 6 weeks ago, received back that survey. And the highest area of score amongst the 15 questions or so that we asked was on their belief that they had support from their supervisor or a good working relationship. The lowest score that we had was the lack of perceived opportunities for growth inside the organization. Things like career ladders, other areas for promotion. The number one place that we lose staff is at the 2-year mark. And we hire quite a few bachelor's degree folks that are called qualified mental health professionals. They work in a variety of capacities. After 2 years, and if they gain a master's degree, they're a licensed professional counselor. And that's a ticket to move up and out of our organization. It's also a point at which we want to keep these valued folks. So I think your question's spot on. It's one we need to learn a lot more about.
I think one area that you may benefit, not just surveys, conducting one-on-one interviews will be very helpful to understand the needs, because sometimes it's difficult, sometimes people may not express it efficiently or the correct, if I have a long survey, I just want to complete it. And I'm not being very honest, but having that one-on-one conversation, I think will be helpful to see if there's any emerging themes across different domains within your departments. So that's just a recommendation. I really appreciate the work that you do for our community, and I hope you're all doing well and maintaining your health, both physical and mental. Thank you.
Thank you.
Thank you very much. Manager Zamora?
No question, just a rah-rah speech. I'm going to be at that end of the table. It's a question that Dr. Zuniga asked about our LGBTQ community. Our staff is incredible. They're very culturally competent. They go out of their way to make sure that everybody is comfortable, that they nurture, and that they love. And that's an important thing for everyone in the people that we serve, the patients we serve. And as you've heard me say this here at this board, I'd say it over there too. It's about the patients. It's making sure the patients get what they need. At our P&O committee, talking about our housing and our places for treatment. When we built the terraces at Oak Springs, one of the judges was there. Don't remember who it was. Said, we need another one. I said, well, give us more money. We'll build more for our homeless. At the Guy Herman Center, Judge Herman came up to me and said, hey, Zamora, we need another one up north. I understand, Judge Herman. We'll get another one. Give us more money. As far as staff, I tell them every time I have a P&O committee meeting, which is once a month, they are the shining example of how behavioral health should be done. They really do a good job of taking care of the patients that we have. They really go out of their way. As far as, keeping people, retaining people, as Hal and David have said, sometimes it's not always about money, but keeping them happy. And many of them are very happy with doing what they know is right, that they're out there to help the patients make sure they get better and stable. And I'll end this with one of the statements. My son, who's a civil engineer, used to work for TxDOT. My patients would always tell me, hey, tell your son that we need to fix I-35. Tell your son to fix this road. And my son I'd listen quietly, smile, nod his head, and says, sure, give us more money. And I'll end it with that. Am I right, Chair?
You're amen.
Thank you very much, Manager Zamora. I know that Manager Greenberg was with us virtually, so I don't know if she has any comments or questions that you would like to make at this time?
Thank you. First of all, I want to commend you on your work, and I know that it has been challenging over the past couple of years, so we certainly appreciate you. If you could quickly update us on your work serving people who are experiencing homelessness, that I think would be useful. Thank you.
Oh goodness, where do we start?
I'll say a few words.
Sure.
Our board chair appointed this last fall a board staff task force on homelessness and wanted to look at what role is that housing plays as a health solution, and to what degree were we committed to not only addressing homelessness, but to have permanent supported housing. In that regard, today we have about 1,024 people, I think, in a variety of housing. We currently are working on 3 sites, 2 on Manor Road and 1 up north with the city called the Bungalows, a hotel that's being converted to a permanent supported housing arrangement that we will operate. And then we have programs. We have outreach teams. We support the HEAL initiative that the city has, in which they're addressing folks that are in shelters. So we have programs, but most importantly, on our July board meeting, we're bringing a plan to the board of staff to look at a 3-year aligned strategic plan for the number of housing units. The draft plan has that we're planning on developing 411 additional permanent supported housing units over the next 3 years.
And with that plan, which I certainly commend you on, how closely do you work with the Downtown Austin Community Court, with ECHO, with Sunrise, with those who are, directly involved with day-to-day people experiencing homelessness?
Yeah, thank you. In the same relationship we have with you, and it's an extraordinary, it's back to the hospital bed availability, in which for you, we operate a 6 private psychiatric hospital network and purchasing episodes of care. For the Downtown Community Court, we're the administrative service agency for matching folks with substance use disorder treatment. So we're actively engaged in the Downtown Community Court every day, working with Judge Coffey and alternative sentencing in that
What
regard.
about working with the case managers, aside from Judge Coffey and the sentencing, the intensive case management?
Yeah, and so working closely with them in the one area that they're looking at, they look at more areas than simply the treatment, but we're working with them as that agent in being sure that folks are compliant and having good outcomes with their treatment programs.
Thank you.
And then, ECHO is a very important member working with us. We have a staff member who's on the continuity of care committee, kind of over top of ECHO. We submit our HMIS data, and we actually fund a good part of ECHO's what's called coordinated assessment in a prioritized list for folks going into treatment. So excellent questions, and these are key collaborative community partners for us.
Thank you.
Thank you very much, Manager Greenberg. We appreciate that. Hal, David, thank you very much. This has been a great dialogue. I think we've learned a lot, and I hope we can do this again soon.
Look forward to it. Thank you for having us. Thank you for your support. Thank you for allowing me to serve Central Health.
Thanks again. Manager Mafwani?
Dr. Bell, for don't throw something at me if this was something that I missed in one of the dense strategic planning meetings that we've had, but I could benefit from understanding a bit more where Integral Care's work stops as well as overlaps with central health led work in behavioral health. And what comes to mind is the mobile units particularly. And if I remember, there was collaboration with Integral Care, or there might not have been, I'm not sure, but I'm scrambling up in my head, and I feel like I might benefit from an instructive around where those things cross over and not. And I don't know what the forum is, but I'm just putting it out there. It doesn't need to be, certainly not right now.
Sure. Mr. Giesler.
I could provide some actual recommendation on that, but I'll defer.
No, please.
Well, I think as part of the budget discussions that are coming up this summer, starting now, but obviously culminating in a vote in September, that's a good forum, because then, we can talk about the funding that we're doing for mental behavioral health, but also serving those that are unhoused and experiencing homelessness. And it is a challenge sometimes to make sure that you've got the circles drawn in the correct proportion to show the overlap, just because of the different funding sources that they receive. But nonetheless, I think we can have, let's take a look at something and come up with the framework.
Great, thank you very much. Manager Valdez, quick.
If you could make that on a board level for those that are interested.
Yes.
Participating.
Yeah, definitely. Thank you very much. Any other comments? All right.
Maybe during our break.
Agenda item number 3, receive and discuss a presentation regarding Sendero Health Plan, strategic alignment with Central Health, equity-focused healthcare service strategic plan, parenthesis, healthcare equity plan. I'd like to invite Ms. Betty DeLargy and Mr. Wes Durkowski to present.
May I ask a question?
Yes, you may.
Is it possible to move that table a little bit this way, so I'm not like this?
Sorry,
No, it's not you. I think it's just, I don't know if that was blocking the camera. That's okay. Thank you.
Is that better?
Much better.
Welcome, Wes and Betty. We appreciate the time that you're going to give us this evening. And as you may have heard from the previous individuals, what we really are looking at is not necessarily a presentation, it's a dialogue. And we want a dialogue about, first of all, with Sendero, a lot of questions around how do you fit into the enterprise? What do you bring to the enterprise? Those have always been questions. I know I have the privilege of sitting on your board, so I know that there are other board members that have asked that question. And actually to hear from you, where do you think that Sendero is aligned with Central Health? And where do you think that maybe we might be a barrier to keeping Sendero from being successful? So I just want to throw that out as an entrance. What we usually do is let you guys sort of start it out. I may ask a few questions after you give us some comments, and then I'll go around the room. So either Betty or Wes, either of you can start.
I think I'll let Wes start.
That sounds like a winner.
Delighted to jump on that one. So managers, thanks, and we'll discuss briefly and see where it goes. So it is an interesting way to put it, and it's funny because I usually think of it as the reverse. The burden is on us to explain how we are not preventing Central Health from achieving its full. I never really thought of it the other way. That's funny. But, the simple way I would summarize is as a perfectly understandable question or an appropriate discussion, because as we sit here, you have two very experienced insurance industry executives, I should say, board chair, in a place that's focused on the delivery of indigent care to people without insurance. So from the very start, the question is, how does this align? And I know that's always been a question that's in some form has been around since the beginning. But at the same time, the simple answer is at the same time in Texas, it's fairly well accepted, like in most states, that the insurance industry does play a role in providing low income, the foundation for low income and uninsured through Medicaid insurance. So the simple thing is to say is we're excited to participate in the Guidehouse Strategic Planning Engagement this year, because we're hopeful that as it progresses and finishes up over the next few months, it'll give us an opportunity to fully address those questions and show where there's natural alignment and to what extent. The simple thing is in the earlier part, I think for Central Health, I had identified some strategic imperatives: access to care, care coordination, data and engagement. And, all of those things are right in line with the goals of insurance. So in a lot of ways, maybe it comes down to a financial question. Is there some financial benefit to an enterprise system of care that can be realized through leveraging insurance as much as it makes sense? So I hope that helps with that.
Perfect. Betty, anything to add?
I think from a strategic planning perspective, maybe I could speak to that. And I think maybe it's appropriate to say what we're looking at right now. From a board perspective, we're really analyzing where Sendero is right now and where we're going. I think as many of you know, Sendero is participating in an RFP for the Medicaid Star Plus program. It's very early stages. It's in a administrative partnership with a very large entity out of Pennsylvania. And it's a very preliminary stage, and there are a lot of details still kind of working through. One thing the board is doing is we are continuing our relationship with Guidehouse, who's been so helpful in strategic planning for Central Health. We are engaging Guidehouse to pretty much oversee the process for the board of Sendero with participation from Central Health to make sure that if Sendero goes forward or asks permission to go forward with this Medicaid proposal, that it is the appropriate thing to do. So Guidehouse, I've been going back and forth with Guidehouse on a letter of engagement and parameters for how they would help us work with Wakely, the actuarial firm who's been doing a lot of work for Sendero over the years, work with a steering committee of the board and with Wes. And Mike Giesland has agreed to be on our steering committee with Ahmet and also with Jeff, who's left. No, he's hiding. And with myself to work with the consultants from Guidehouse to oversee kind of this Medicaid proposal. If it is the pleasure of Central Health to go forward, we want to be sure that it is the best thing for Sendero and ultimately for Central Health to do it. And if it's not the appropriate thing, we want to be sure that that's the correct decision. Whichever way it ends up being, we want to be sure we've got all of the facts and we've done the best we can to make that decision. The other thing that Guidehouse is going to assist us is to examine the MAP CHAP program, which I think some of you are probably more familiar with than I am, which is moving some of the MAP participants over into the fully insured program through Sendero. I think the people that have moved over are very happy with the program, but it is expensive to Central Health. In some instances, it is double paying for some care that Central Health has contracted with Ascension to receive. We're in the process of, with Central Health, analyzing how that care is delivered through MAP versus, I know I saw John earlier, versus how it is, yes, how it is delivered through a fully insured program, just to see how that kind of stacks up. I, for one, am very interested to see if how care is different when it's fully insured versus through a MAP program, if it is. So we're looking at that, the long range feasibility of the CHAP program. Right now, it is a financially good program. It does produce a return accessing federal dollars. I don't know that the federal program was supposed to work like this, but I think Wes and the actuaries figured out a great way to make it work in our favor. It pulls down a lot of federal money that supports Sendero's finances. But we want to look at the long range feasibility of continuing to do that program because it is a cash drain on Central Health. So that's kind of where the board is going right now.
Thank you very much, Benny. I appreciate that. Just one comment. I know that, a health plan for expansion's sake and for sustainability's sake needs to have a varied portfolio. On the other hand, I do know that your parent company tends to be a little bit risk adverse. And so I think that as we go forward, I know that we have to marry those two in some ways. And I'm not sure that that Sendero realizes you are important to us for the population that you serve for us. You're extremely important, okay? But we may or may not be able to support the expansive or expansion efforts that you may be undertaking, all right? And I'm glad that Guidehouse is here to provide us, that information. On the other hand, I also think that we have to weigh the risk, not only to Central Health, but to Sendero, to keep Sendero. If we get into something that is so risky and it could shut Sendero down, that's not a good thing either.
And if I may add, that is part of what we're asking Guidehouse to
Correct.
examine, is the ultimate exposure to Sendero and also to Central Health.
Correct.
Especially for the Medicaid program.
And especially as we look at, how we move forward, is expansion the way to go? Or is it that we manage the CHAP program as well as ACA and wait for a better opportunity that is good for everybody? Wes, you want to comment at all?
No, that could completely make sense. And that's the whole point of, the Guidehouse is just, here are all the options. We've definitely covered every appropriate potential avenue. So this is a good way to bring it together, hopefully in the next few months, and say pros and cons of each, potential risks, potential financial benefit reward, and then it'll make it easy. Hopefully, should make it easy to make a decision.
Excellent.
Should be pretty obvious.
Thank you. Manager Musaiti. Your mic.
Well, thank you. I really appreciate you coming. I think, as you know, personally from my standpoint, want to provide care to as many people as we can, but also wanted to be very responsible in I'm more of a risk averse person, maybe the part Dr. Bell alluded to. And I'm looking forward to see what you have for us down the road in terms of proposals that we can provide as care to as many people as we can, given our limitations as well. So that's really what I'm looking forward to hear from you soon and what you have to present on future plans. Thank you.
Thank you very much. Any comments?
That's the plan. Yeah, we can do that.
Thank you. Is Manager Greenberg still with us? Manager Greenberg, any questions, comments? You're muted.
Yeah, no, I just appreciate the update. Thank you.
Okay, thank you very much. Manager Zamora? Thank you very much. Manager Jones.
Thank you for coming. I want to make sure I'm clear. Are we the only managed care company of the hospital that have a hospital district that have a managed care arrangement?
No, they each have a managed care company, except for JPS maybe. So El Paso, San Antonio, Houston, Harris County, and Dallas, all have health plans.
But we're the only one that doesn't have a traditional hospital district, though.
Correct. Yes.
Okay, thanks for sharing that. The other question I have is, one of the challenges I hear from the community is that we have so many systems of accessing care that people are confused. We have MAP. We have, well, we don't, but we have Medicaid. We have Medicare for those who have other issues. We have a managed care company. I guess my question is, I don't know as much to you all as it is to us. In our efforts to try and ensure that we get the maximum dollars for our population, are we confusing? Are we helping them to understand that? So my question to you is, does the general community understand what Sendero is and how they may or may not participate in that area? I know you've done a good job of outreaching, but I'm still hearing this when I go out in the public as, well, what is Sendero? And so that's the nature of my question. And is this unique to our unique arrangement compared to other hospital districts, or is it consistent?
No, I think that is a pretty common challenge. And I would say what we're happy about, so granted, yes, there's always more we could do to improve the image, and both us and I know Central Health every few years takes that up pretty seriously and does the eval about like how can we improve overall knowledge in the community. But on a day-to-day basis, the important thing that we know is functioning is that Central Health maintains a pretty extensive intake and outreach, and we usually rely on them to be the clearinghouse. So if you're to check eligibility, so whether you're Medicaid, MAP, or ACA, Sendero Chapter, or anything like that, you should be connected going there. But I completely understand what you're saying, that if I'm in the community, I don't always put that together. Like I think MAP is for somebody else. I hear Central Health, I hear Sendero, but so completely agree. We'd always like to be able to do a better job about making it as easy as possible for people to understand, what's available to them.
Thank you, Manager Jones. Manager Valadez.
Well, I'm a cheerleader for Sendero, because having seen the plans as a navigator and enrolling people, you get to see the added values and the work that Sendero has done for our community, especially our poverty and targeted population. As those that we convinced to get on ACA as opposed to in a full service insurance plan, as opposed to MAP, which is not, it's a very dysfunctional, not comprehensive provision of some services to our patients. And that's one of the things that I personally had hoped that we would have kind of overcome by now. I was of I'm in the same court that one of our former officers and Central Health board members, Lynn Hudson. Lynn Hudson was a believer in the fact that our MAP population should be our Sendero population. She always felt that way, and she couldn't understand why it wasn't, why we weren't more efficiently using Sendero and community care to provide services. And so for me, as a member of this board, I personally would like to know if that is something that we can in fact do. CHAP is not MAP, MAP is not Sendero. And if there is some confusion out there in the community, well, we need to clear that up already. And so while we were out there rebranding Central Health as to whether or not we should change what we look like. Maybe we needed to have done a better job on looking at how we can better brand our enterprise and show how we are offering a complete range of services to our population, and that we were created to support and provide services to, hospital and medical services to. And so I like the fact that you all doing a good job on mental and behavioral health with respect to other plans, and supporting our communities with those added value services. But really, there should not be confusion. If you're a MAP patient and you're an ACA full comprehensive Sendero patient, member, those are two very distinct items. And to me, you're a Sendero and you're not MAP then. So if there's some confusion, then why are we still having confusion? Maybe I'm confused as to what exactly is being put out there. And if that is in fact the case, then we need to fix that real quick. So, because I would like to see us continue to offer the same services that are being offered in other healthcare districts, regardless of whether or not we're pink or blue. We have a hospital or not. We are engaged in services that our hospitals should be providing. And if there's a way to get that through the complete ACA world, as opposed to MAP and central health expenditures, then that's what we need to do, so that we know that our patients are fully served, as opposed to haphazardly served in MAP. And so anything that we can do to help clarify that with our population, I would appreciate.
Thank you, Manager Valadez. Anybody want to comment? Go ahead.
What, are you going to comment to me?
Sure, of course, yeah.
Thank you.
No, I appreciate the comments, and good news, bad news. The bad news is, I think given the nature of the nation's healthcare system, especially in Texas, there is no simple one-stop answer. And so that's the challenge that we're addressing here. And also because of that, even as I sit here now, I'm not sure I see a one-stop solution. It's more the best of both worlds, bringing the pieces together as much as we can. So, at the end of the day, then the challenge is on us to kind of find this present it seamlessly to the public and say, whether it's 1% CHAP, Sendero tiny or more or something like that, who knows? But all the pieces are going to be necessary. Like, we can't really go it alone or anything like that.
Thank you very much. Manager Zuniga.
I just wanted to bring it up for you guys also. Insurance is one of the last places that transgender community has a hard time with getting their name changed.
So.
So that's the last place. Insurance is the last place that transgender community has trouble getting their name change is insurance, and that every time that a person who's transgender hits the healthcare, they have the unfortunate experience of having trauma caused by us, and it may cause someone not to get healthcare, not to get care, not to have good health. I was wondering what Sendero was doing to address this disparity in transgender health.
So the challenge from our end is that because this is mainly a CMS administered program, we're working within the confines of systems that are handed down to us, and that includes eligibility and all the identification around that. The thing I can vouch for is that I'm pretty comfortable that the attitude and message, and hopefully the execution on the staff side, is just this recognition of the individual, that as soon as you talk to us, we know we're talking to a person, and then we can sympathize and help together work to address the unfortunate system challenge.
And I know it's an old system, and we have to start somewhere, getting those names right.
It's outdated. Yeah.
Seems like there has to be a way. Thanks.
Thank you, Manager Zuniga. Manager Matwani? Thank you. No? Right. Thank you both, Betty, Wes. We really appreciate this. We enjoy the dialogue. I think the more dialogue we have, the clearer it becomes, how we work as an enterprise and how we move forward. So I look forward to the Guidehouse engagement and the information that will bring. And we'll see you soon.
Well, thank you all for your time. We appreciate you having us here tonight.
Thank you.
One last. Before you leave, do we have an estimated time? We have an estimated time as to when the proposal for the Medicaid Star Plus program will require our involvement?
I think the next step is September, late August, September.
Okay,
And so I think probably around that time, although HHSC is notorious for missing deadlines, we're on a very tight time frame with
Right.
Guidehouse to do this analysis, do the oversight. So it'll be this summer. It'll be good.
okay, thank you.
Thank you, Manager Valadez. Agenda item number 4, review and provide direction to staff on the prioritization and tentative scheduling of items for consideration at the future Central Health Board and Committee meetings. Brianna Yanis and Perla Cavazos will be presenting.
Okay, I'll start by going over the tentative July agendas. So for Strategic Planning Committee, on July 27th, we will have a deep dive on fiscal year 23 strategic priority and update on equity-based systems planning phase 2 process, operational and financial stability plan. Then for the Executive Committee, which will also be on July 27th, we will go over tentative schedules and discuss the CEO performance evaluation timeline. For the regular board meeting, which will also be on July 27th, we will have our regular consent items, minutes, and investments. The financial items will be May and June financials, and then we will have the proposed fiscal year 23 central health budget and tax rate presentation. We will also have some HR updates, including workforce demographics, hires and turnover, recruiting strategies impact, and a memo on the EEOC reports. And then we will have the Dell Medical School update, a Sendero update, and we will approve the consultant contract for equity-based systems planning phase 2 and discuss scope and process. And I will turn it over to Perla.
Thank you, Brianna. The only thing I want to emphasize is I just want you all to be aware that we're stacking 3 meetings. So we do plan to start strategic planning at 4 p.m. That is the plan, but I believe it will be a long night. So, but I just wanted to make everyone aware that strategic planning is not meeting at the regularly scheduled second week of the month at 1 p.m. We're stacking it. And again, this is to provide a bit of a break to the Board of Managers during the month of July. And then we have updated August and September as much as we can to date. We may add some items, move some things around, but as of today, it's up to date. And then Mike, you wanted to talk a little bit about budget timelines as well.
Yes. So members, a question for you for some guidance. It relates to bumping up the adoption of the budget, so the vote that you take on the tax rate and the budget by 1 week. The reason for this request is to allow more time between that vote and the time that it goes to the county commissioner's court. And that way we can have more one-on-one sessions. We put together a lot of material that we send over to the county commissioner's court, making sure that we have ample time to not only just send it over there, but then to have follow-up conversations. So that's the reason for this. So we've put together a couple of options. One option is to stack both the public hearing and the vote for the budget and the tax rate. The other option is to move up the public hearing by 1 week. And then the next week, you take the vote on the budget and the tax rate. So one option, you stack the meetings at once. And then the other option is you just move that public meeting up 1 week. Or you can keep it like it is. So there's the third option, obviously. But that's what we would propose to you.
What would be the date for that public hearing?
If you move the public hearing up a week, it would be Wednesday, August 31st. Option 3 would be do nothing. Just keep it like it is. So that.
Right. Option 3 would be to move the public hearing to August 31.
Okay, so.
Well, I've reassigned numbers to the options, obviously, and I didn't.
It's on the, yeah, it's on the
Okay.
screen and it's on the board.
Oh, I
packet.
see. No, somebody assigned numbers there for me. Okay, good. I'm sorry. My apologies. Yeah, thank you, Carla.
Okay,
Well,
go ahead. Manager Valdez.
I personally am not married to
Speaker,
eliminating.
microphone.
I personally am not married to skipping our July meeting, if that would help anybody. Help lessen the load so that it's not all week to week, week to week to week, and everything's stacked up on each other. But if that's apparently that's the wish of the board, but I'm just telling you.
We didn't skip a July meeting. The
Well, it would be
meeting
July the
is-
20th.
It's just space.
Yes, that's right. We'd have the 40 days.
Yes.
40 days.
Well, it's
no
not
meeting.
40.
Well, it
I
feels
wish
like
it
it.
was 40.
I think it's 40. It feels like
All right.
40. Okay.
We are
Today,
having a board,
from today to the end of July.
Okay.
right.
And today's the middle of the month. So that's like at least 40 days to me. Either way, I don't have a problem with long meetings. If your staff, because I know after we have our budget, y'all go on vacation because you need it. But you know what? I think everybody does. So if you recommend, Mike or Pedla, if you're recommending that we do the option 3 or whichever one, just tell us that so we can take a vote on it if that's what you're asking for.
Manager Musai.
Personally, I would prefer stacking meetings. It's much easier for planning and logistics on my end. If I take one day off, it's easier than coming multiple times throughout the week. So that's my personal preference.
But in July, you'll be gone, but you will be here for our meeting, our board meeting, correct?
July?
Yeah, our July
The
meeting.
27th.
The 27th.
I do plan to be
back.
Manager Valadez.
I'm only going to be out for a couple weeks.
Oh, okay.
The July through most of August, the schedule is going to remain the same. The only thing that Mike mentioned that would be changing is really just the public hearing and the budget vote. That's where the option 2 and 3 come into play. And I think, as he mentioned, it would just allow us more time to meet with commissioners to make sure that they understand the budget and that we've answered their questions before Travis County Commissioners Court votes on our budget.
But none of you all are recommending a Saturday public hearing?
No.
None of you? Okay.
Okay.
Because I know when the public is mostly available, but that's okay.
Just to be clear,
All
Mr.
right.
Valdez,
I'm sorry.
you can't have a public hearing on the Saturday.
Manager Greenberg, sorry.
Oh, sorry.
Yes, if the staff would like more time to visit with the judge and the county commissioners, then I think we should go ahead and have one of the options of moving up the public hearing so that staff can arrange those meetings.
Thank you, Manager Greenberg.
Does she need a motion?
I need a motion for that.
Sherry, is that a motion from you?
That is a motion. I move that.
I get it.
All
Thank
right.
you.
Is that okay? Do I need one from a executive committee member?
Oh, you might.
I'm sorry, that would be ideal. Okay.
Yeah, you need one. That's right. So
So you
Cynthia
you
can
make the
motion or
motion
anybody else.
and then you second it.
Let's move it up a week, back a week.
No, the motion that should be on the table is to move the public hearing to August the 31st. Correct?
Yes.
All right. Yes, Manager Musaiti. Wait, let me get the motion and second it, and then we'll have a discussion. Okay? So I've got a motion from Manager Valadez. I have a second from Manager Zuniga. So now, is there any discussion? Manager Musaiti.
Just for clarification, so what the motion is on the table is to have a public hearing on Wednesday, August 31st.
That's correct.
That's right.
So given that it's only one meeting for public hearing and most of our meetings are on Wednesday, perhaps we should consider changing the day to accommodate other individuals who are unable to attend Wednesdays. In the past, we folks have expressed that they cannot make Wednesdays because of religious obligation. Is that Mr. Jones? You're more aware of that Wednesday prayers, I believe, commitments for individuals.
Wednesday is
A church night.
So I think I'm not on the committee, but I would hope that we can take that into consideration given it's a request that we've had in the past from other individuals.
David?
Keep in mind, there are two limitations. The hearing must be held on a weekday that is not a public holiday, and it has to be within 7 days of the vote.
Got it.
Just saying.
All right.
That would push off the other meeting we have to push back.
That's correct. So any other discussion? Hearing none, all in favor? Aye.
Aye.
Any opposed? Any abstaining? Motion carries. Okay, Bella? Is there anything else for this item? Thank you. I'm sorry, Mike.
This, come back and talk about the branding issue. This was put on hold during the pandemic for a variety of reasons, but you'll recall there was an extensive consultant report and a lot of analysis done. And what we would like to do is just tee up an agenda item in August to discuss at least aligning the artwork. Realize everybody has their own individual names, but in terms of having something that looks familiar from one entity within the enterprise to the other, I think that that is a good first step to take, to consider. But again, we'll bring this back to you. We'll have a discussion about how we would propose going about this, and obviously include enterprise partners here at that particular meeting. Just a heads up, that's all. Thank you.
Thank you, Mr. Giesland. Appreciate it. All right. We are done with that agenda item. Agenda item number 5, discuss the timeline of the performance evaluation for the Central Health President and CEO. Members, we have discussed last year to line up the annual performance evaluation as closely with the end of the fiscal year as possible, mainly so that Mike will have accomplished the things that we have asked him to accomplish, and we can opine on them. He has his contract is through October the 31st. So on July the 27th, our next meeting, we will present a timeline and a process for the next performance evaluation, which will include sufficient time for the board evaluations to be completed, collated in advance of the meeting, and then we will review and have a discussion with Mike, as we have in the past. Any questions, concerns, confusion? Great. Thank you, guys. Agenda item number 6, confirm the next regular executive committee meeting date, time, and location. Managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, July the 27th, 2022 at 5 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. I have a motion from Manager Zuniga. I have a second from Manager Valadez. Any discussion? All in favor? Aye. Any opposed? Motion carries. We are adjourned. And in the efficiency of time, I would like to go directly into the Board of Managers meeting. Managers, we have a quorum, so you can step out as needed to take care of biological issues. Just make sure that we have at least, is it 5, David? Yeah, 5 people within the meeting at all times. Good evening. Today is June the 15th, 2022, and it is 6:42 p.m. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. The first item of business will be the consent agenda. Consent item number 1, approve the minutes of the Central Health Board of Managers May 25th, 2022 meeting. Consent agenda number 2, receive the quarterly investment report and ratify Central Health investments for May 2022. Do I have a motion? Manager Valadez.
I move that the board approve consent agenda items number 1, C1 and C.
I have a motion. Do I have a?
He wants me to repeat it with
But,
the speaker on.
I
I apologize. I move that the Board of Managers approve the consent agenda items C1 and C2.
Do I have a second? Okay, I have a motion from Manager Valadez. I have a second from Manager Zuniga. Any further discussion? All in favor?
Aye.
Any opposed? Any abstaining? Motion carries. We will now proceed to the regular agenda. At this time, I'll entertain a motion to limit debate for all items in the regular agenda for our meeting this evening. Manager Valadez.
I move that the Board of Managers limit debate on all items on the agenda to 3 minutes per member per item.
Do I have a second? I have a motion from Manager Zuniga. No, I have a motion from Manager Valadez. I have a second from Manager Zuniga. Any further discussion? All in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Manager, item 1 from our regular agenda will not be taken up this evening due to unavoidable circumstances. That item was number 1, receive an update from the University of Texas at Austin Dale Medical School on Central Health's financial investment and how it has contributed to the fiscal year 2022 outcomes supporting Central Health's mission of serving indigent residents of Travis County, and an update on the University of Texas at Austin Dale Medical School's future opportunities and challenges. Regular agenda. Agenda item number 2, discuss and take appropriate action to accept a grant from the Episcopal Health Foundation to support phase 2 of the Strategic System of Care Planning. Monica Crowley. Manager.
Even though item number 1 is not being discussed here tonight, I just have a comment regarding that.
Okay.
My concern is that this item has now been moved to the July the 27th.
Microphone.
I have a concern, this item's been moved to July 27th, am I correct?
You are correct.
And as we just finished in our executive committee meeting discussing how extensive that agenda item will be, I want to ensure that we have adequate time to discuss this item. So limiting it to 3 minutes or whatever is not going to be adequate. So I just want to go on record saying that I think we need to make sure that we have adequate time to discuss this item.
Point well taken.
Thank you.
Thank you. Monica?
Thank you. Monica Crowley, Central Health. As we discussed last week during the Strategic Planning Committee and was described in more detail in the backup for this agenda item, Central Health applied for and was awarded an additional $600,000 grant from the Episcopal Health Foundation in support of the next and final phase of the equity-focused system of care planning work, the operational implementation and financial sustainability planning that we hope to begin in the coming months. Tonight, we are recommending that the board take action to accept this $600,000 grant.
Manager Valadez.
I'd like to move that the board accept the $600,000 grant from the Episcopal Health Foundation as recommended by staff.
Thank you. Do I have a second? Manager Musaitis. I have a motion from Manager Valadez. I have a second from Manager Musaitis. Any further discussion? Hearing none. All in favor? Any opposed? Any abstaining? Motion carries. Thank you very much, Monica. Manager Musaitis.
I just want to thank Fiscal Health for their grant and for their commitment to equity in this community. Thank you.
I echo that thanks, and I think I can probably echo it for the rest of the board.
Yes.
Thank you. All right. Agenda item number 3, receive an update and take appropriate action on setting the Central Health tax year 2022 homestead property tax exemption for Travis County residents who are over 65 or disabled. Lisa Owens will be presenting.
Good evening. Sorry I cannot be with you this evening, but it's good to see you all. Tonight I'm going to be presenting the Central Health proposed exemptions for fiscal year 2023. As you will recall, last year our exemption for over 65 and disabled was $100,000, and we currently have our homestead exemption at the maximum allowable by law, which is 20% of the value. We are proposing that the board recommend to Travis County Commissioners Court to increase our over 65 and disabled exemptions to $110,000 and to maintain our homestead exemption at a maximum allowable of 20%. You will recall that the Travis County Commissioners Court ultimately approves our tax rate, and this is part of that process. We will be going to the Commissioners Court June 28th to request them to set our exemptions. And just yesterday, Tuesday, the Commissioners Court did approve Travis County exemptions, and those are also being increased for over 65 and disabled to $110,000. We did look this year, which we talked about at length last year, at a more methodical way of increasing this. We did a 3-year look back at the average increase of the average taxable homestead, and that was 7%. So we feel like the 10% increase from 100 to 110% helps significantly with those increases that we've seen over the past 3 years. And with that, I'm happy to answer any questions.
Thank you very much, Lisa. I appreciate that information. Manager Valadez.
I'd like to move that the board recommend that the Travis County Commissioners Court both increase the tax exemption for Travis County residents.
Microphone. There you go.
I want to keep it on. That's what I want to do. Okay, I move that the board recommend that the Travis County Commissioners Court both increase the tax exemption for Travis County residents who are 65 and over or disabled to $110,000 and maintain the homestead exemption at the current maximum statutory rate for the Central Health 2022 tax year.
Thank you. Do I have a second? Manager Musaiti. I have a motion by Manager Valadez. I have a second by Manager Musaiti. Any further discussion? Manager Musaiti.
I just have a quick question. Can you remind me what was the exemption last year?
100,000.
100,000.
Okay, that's it. Thank you.
Manager Jones.
Yes, I just want to confirm, as one who would benefit for this vote, that there's no conflict.
That's right.
Just wanted on the record.
Manager Zuniga.
Is 110 the top? Is that the most we can do?
Lisa?
It is not. It is not.
It is not, right?
No, it is not.
Right.
How?
Yeah, how high could it be?
We are usually aligned with the Commissioner's Court. So I think it was explained to me that the Commissioner's Court is actually the entity that has the ability to determine the exemption rate.
So theirs is 110?
That's correct.
So we're matching theirs.
Correct.
And theirs was approved yesterday,
That correct.
as she just
So
said.
it would be pointless to say more.
That correct.
Okay.
Manager Valadez.
I called for the question.
Call the question. All those in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Thank you, members. Agenda item number 4, receive a presentation on the fiscal year 2022 capital projects in process and fiscal year 2023 capital planning budget. Lisa Owens will be presenting.
Hello again, Lisa Owens, here to talk through our capital planning budget. This is a preview to what you are going to see in our budget July 27th. However, we have been preparing quarterly reports and we're unable to present those at our last meeting. So I'm starting tonight, one, of course, aligning us with our strategic objectives that are in the budget, continuing to develop sites, which is the majority of our capital funds and capital projects. But I'm starting tonight, the first few slides that you have are an update as of the second quarter. And we'll be doing similar reports like this, so welcome any feedback after the meeting, follow up to report out on our major projects. The major projects are the projects that the board approves. So you'll see here listed what the estimates are through the remainder of FY22. And for our projects that we anticipate being completed, such as Hornsby Bend and Dow Valley, you'll see that we anticipate the bulk of those expenses in next fiscal year, majority of that being construction at this point. And a preliminary budget was approved for Rosewood Zaragoza of 1.1 million. And then, as you've seen in the past, Colony Park and clinical services and headquarter consolidation, which is the Hancock building. We anticipate the Red River realignment completing its work this year. So that will roll off of the schedule in future years. I also prepared very detailed updates, sources of funds as well. Some of these funds had certificates of obligations that were secured to support the project and will need additional reserves this year as a result of increased budgets, which the board took action on earlier this year. So I call these our active phase. We're in active construction. And I'm not going to go into grave detail on these. The summary is there for you, but just wanted to talk through that. Rosewood Zaragoza, I believe my colleague Stephanie and her team will be coming back this summer with a more full project budget. We do know that we anticipate moving quickly on that project. We had a preliminary budget approved of 1.1 million. And then still high level budgets and planning going around our Colony Park Health and Wellness Center and our clinical services headquarter consolidation. So I'm hopeful that these give you a good picture of where we are on the projects. And similar to clinical services, sometimes the dollar spent doesn't necessarily equate to the activities that have taken place, but this is the financial component. And you will be hearing frequently from our colleagues that are working on the Eastern Travis projects and these projects about the status in the Strategic Planning Committee and other venues. So lastly, I'd like to focus on FY23. We are going to be bringing forth your budget, draft budget on July 27th. And in that, there will be a line item that we've traditionally had in there to increase our reserves, which is cash that is set aside for capital improvement projects. I highlighted in red the column. The first column shows you where we think we're going to end up with the capital reserves. This is all sources. It includes debt financing as well as cash reserves. And then what we think we're going to need to add to that in order to fund those projects next year. And then an estimate of where we are potentially at the end of FY23. So focusing on the column that I highlighted in red, as I mentioned, we do anticipate appropriating additional funds for Hornsby Bend and Del Valley to finish those projects with cash reserve next year. And then we put a placeholder in just to give you some numbers tonight. But as I mentioned, the Rosewood Zaragoza will be coming back with a full budget. And then finally, we have future clinical services funds. This is a very important part of this budget. As we know, there are active projects that we want to pursue, but they have not been approved by the board yet. So these are not specific projects identified. However, as we've discussed, there is a continued need for additional clinical services. So this would be for future clinic facilities that the board approves that the staff move forward with. And then finally, in the last three rows, those are a lot of operating necessities that we have. We do anticipate potential activity on the campus. We don't know, we don't have anything specifically identified. Again, I probably should have asterisked that one, apologize for that, but that would be brought back to the board. We always are needing to replace equipment and technology. And as we grow our facilities maintenance and operations is going to start to increase more. We have, as our buildings age and as we have more buildings. So that's a high level summary of the $47.5 million that we anticipate putting into your budget July 27th when we bring that forward. And with that, I'm happy to answer any questions.
Thank you very much, Lisa. Manager Greenberg.
I just want to tell you how happy this makes me to see a capital
Thank
budget.
you.
Thank you, Lisa.
I appreciate that.
And staff, yes, near and dear to my heart.
Okay.
I really thank you. It's very helpful to see the capital budget and to see the capital planning and to see the projects and the line items. So thank you.
Thank you, Manager Greenberg. Manager Valadez.
I'm sorry. I think maybe my ears were a little stuffed up.
Microphone.
I think my ears were a little stuffed up or stopped up. What did you say? What are the projects that are going to be certificates of obligation as opposed to capital cash outlay? Did you say, or was
The board approved three? Yeah, the board approved three projects that have certificates of obligation funding. That is Hornsby Bend, Del Valley, and the clinical services and headquarters consolidation at Hancock. And
Okay,
those
those are
certificates of obligation were approved for those. Yes.
Okay. And then the others are capital outlay?
Those would be cash reserve, cash capital. Yes, that would come from our cash.
Okay, and there's no project there that could be considered a certificate of obligation expense or not?
Well, that is a great question. We'll talk, I think, more about that. And I believe we hit on that a little bit when we talked about the 8-year forecast. That does not mean that we could not pursue certificates of obligations in the future. It depends on what projects get approved, how close together, the size and the cost benefit analysis of that. But yes, we would always be considering financing options.
Okay, so
and of course the board would be very involved in that decision.
I agree. I would appreciate that, but I would wonder, Lisa, if before we have that conversation, if there are any specific, if there's a way for you to break this out so that we know what we can pay for as a certificate of obligation as opposed to what we cannot pay for as a certificate of obligation, and just pass it out to me and anybody else that may.
Okay, sure. We can list some of that information.
That's all I'd like to have. Heads up. Thank you,
Manager Greenberg.
I'm good, thanks.
All right.
Thank you, Shay.
Manager Jones?
Yes, two quick, somewhat strange questions, I guess. Is Red River open yet? Or when do we anticipate it being opened? I drove by there the other day and I saw it, it looked very nice, but fences are still there. And so do we have a time frame on that?
I do not, it is not open yet to my knowledge. I don't know if Jeff or Stephanie has or Mike has an update on that.
Stephanie?
Actually, Jeff is there in person. If Jeff, you want to take this one? It is not open yet.
Okay.
Actually, before, I need to ask council, are we good? Just to provide, because it is a finance project. Okay. Yeah, thanks for the question. Jeff Canota, the CFO. Red River is substantially completed. It's going through final inspections. Probably won't be open for another couple of months pending those inspections. But to your point, I would characterize it as substantially completed. And so, you know how that goes, just waiting for the final inspection piece of it. Should be open, we hope, in the next few months.
It looks very nice from what I could see as I passed by. So I commend Central Health for collaborating with to get this done. And I think the community will benefit greatly from it. So I want to acknowledge that.
Yeah, I'll thank you. Yeah, just quick acknowledgement that, we worked together with the 2033 fund related to that project. And then you also had included in the project the promenade or the access from the campus down to what's now the current Red River, which will be the old Red River fairly soon.
So that was the only thing. The other question was a quick one. On my way here, I drove on 35. I looked over at Hancock. Do we own that? Are we where are we in the process of?
Yes.
Okay.
Yes, we issued certificates of obligation to purchase the Hancock building.
Okay.
The old former Sears building at Hancock Center.
My other concern is, to the degree we can get someone over there to remove the graffiti.
Yeah, I've asked that. That's a continuous issue that we have there, but we're bringing someone out to remove that.
Okay, thank you.
Manager, wait a minute. Manager Musaitis, and then Manager Valadin.
Yes, thank you. My question actually relates to the downtown development. We have not received any kind of updates. What are the plans for us in the next fiscal year? So I would hope that if you can provide that as a memo or during our meeting, I would like an update on where we're at. Thank you.
Yes, and there's obviously discussions within staff ranks and then reaching out to consultants. But one of the reasons why, when we're talking about financing development and capital projects as it relates to that agenda item, the development markets aren't the same right now. And things need to settle down a little bit and it seems like that each time we hit a critical milestone, and we're coming up on one because the property, we'll finish the grading on the property. The big hole has been filled in. Now it's just about getting the grade down to the proper level. Jeff mentioned Red River opening up. And, our concern is that, we bring something to you, but then it changes. Because the lease market's the typical development business model that you follow just doesn't hold up right now. So we need things to settle down a little bit. And so we've been trying to buy our time a little so that we can put together what all the different options might be. But recognizing if we were to bring that to you right now, I don't know that we could point to any one particular one and say this one is a sure thing. This is what will work the best right now. And that's what we're working through with our partners.
Thank you for that update.
Thank you very much. Manager Valadin.
Jeff and Dr. Bell, if I'm not mistaken, there's an entity that will provide at no cost graffiti, power washing. Thank you, Brianna. We've used them several times down Cesar Chavez and in our neighborhood. So I didn't know if that's what you were maybe considering, or are you just going to pay someone to to do it.
I'll field that. I know we've got contracts in place for graffiti removal. Unfortunately, that's a situation with a lot of our buildings.
Okay,
So,
okay, no problem, thank you.
Just want to publicly acknowledge Jeff is not responsible for going out and removing the graffiti. Yeah.
Thank you very much. And we appreciate your efforts, Jeff. Thank you very much. Any other comments? All right. Agenda item number 5, receive and discuss updates on the 1115 Medicaid waiver, delivery system reform incentive payments, DSRIP program and associated projects, the Community Care Collaborative and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas and the University of Texas at Austin. I would like to announce that the board is convening in closed session to discuss agenda item number 5 under Texas Government Code, section 551.071, consultation with attorney. For the online individual, to log off of the online open session and go to the closed session link that you were sent. Are we ready? Thank you. It is 7:26 on June the 15th, 2022, and we are out of closed session in which we took up agenda item number 5. There was no motion necessary. Agenda item number 6, confirm the next regular board meeting time, date, time, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for Wednesday, July 27th, 2022 at 5 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. Sherry?
I move adjournment.
I have a motion from Manager Greenberg. I have a second from Manager Valadez. Any further discussion? Hearing none, all in favor? Any opposed? Any abstaining? We are adjourned. Thank you very much, members. Appreciate it. I'm sorry?